So the first case we're going to talk about is Patches. Patches is a black-breasted leaf turtle out at the Knoxville Zoo. Here's a normal turtle on the left. You can see the two little nostrils poking forward. This is Patches on the right. And Patches, unfortunately, has a hole in her face that shouldn't be there. And so the zookeepers came to us and asked us how do we evaluate this further and what can we do to kind of fix it?
So the best way we have to evaluate the defect is to put Patches into a CT scanner the same way you would undergo. So on a CT scan, you have a black and white picture like that. We take that picture, put it into computer software where you isolate the bone, and we get a 3D model. So that's where the eyeball would be, the nose, the lower jaw, the spine. You can appreciate that there's a defect between the nose and the mouth. So the soft tissues, which is the flesh, also has a big component into the problem. So on that view, you can see the nose there and the mouth. So there is dirt which can go in and food which can go out. Same thing on that view there. So Dr. Snowdon had to find a way to fix that.
The challenge for us is we can't repair this like we would a cat or a dog or a human for that matter, because the tissues don't work the same way. And so our first goal was, can we create a way, these turtles like to burrow, so can we create a way to keep dirt from getting impacted into that hole? So we came up with a few little face masks to use. This one right here is probably not practical, but sometimes it's just fun to do. But you can see on the right, we came up with a design we think is going to work. And so once we have that design, that it looks good on our model, we need to evaluate that back on our little CT scan. It's not showing up too well. You can see the outline of the mask over top of all those slices from the CT. Once that's completed, we take the next step.
So we print it. So we're gonna just show you a quick video of a 3D printer on the left, which is gonna show up, and on the right is gonna be a computer renderization. Both are very accelerated, so you can see what's going on. That's the head of the tortoise printing with some scaffolding material. That's the same printer on the left side, which is basically like a giant fancy glue gun.
So once we have our turtle face printed and we have our mask printed, which will be on a slightly different printer than this, we're going to get the turtle back into the hospital, give him a little bit of sedation, and we're going to see how it fits. So this first mask was designed just to stay on with a little bit of surgical glue, so it wasn't a long-term fix, but there's no reports of turtles in masks other than in TV, so we wanted to just see how he was going to do with this. And ultimately, he did very well. You can see him eating over here on the image to your right. But the problem is he kept getting the roof of his mouth impacted with food. So while we stopped dirt from the outside, we didn't do anything for food going up in the middle, in the inside. But really, he doesn't have a hard palate anymore. So by the time this mask fell off, we'd already come up with a new design that hopefully would solve both problems. And the way we tried to do that was actually borrowing a little bit of information from dentists, and we wanted to actually make him a tooth where his hard palate used to be. So here's Patches with his second mask, and the big difference is now we have this little hole, this threaded, recessed hole. What we're going to put in there is actually a titanium screw. That screw is kind of crucial because what we're going to do is build a little resin tooth over top of the thread. So here we're just packing in layer by layer of a little dental resin, and on the right side, what we're doing is just hardening that in layer. That's a light that just shines at a certain wavelength. And we're done when this hole is completely filled. And hopefully the mask stays on the outside, the tooth kind of keeps it on the inside, and it brackets things together. So back at the zoo, we can see Patches with her little fancy nose ring. And while it may take her a few tries, she does get her little meal, and she's been doing well at the Knoxville Zoo since this time.
There you go. So the very next case we're going to be talking about is a much more common species, as it was a dog who encountered a vehicle. So the dog had a severe fracture of the forearm. That's the humerus there, which is the bone which communicates with your elbow. These are radiographs, the view from the side, the view from the front, and you can appreciate all the bony fragments which are there, and the fact that the bone is no longer aligned. So it's already a complicated fracture to repair, but you need to be aware that along your arm, you have plenty of nerves which are each associated with an artery and vein. So if you go in surgery and you transect any of those, you're not going to regain full function of your limb. So the best way to fully evaluate the amplitude of the fracture is to put the dog in CT again. So on the left side of the screen, you're going to see a CT the way we see it as radiologists, black and white pictures. That's the elbow joint, that's the broken bone, that's the shoulder joint, and we get this data, put it into the computer again, and get a 3D model which is much more explicit.
So these are great. As a surgeon, I can now start to visualize how I'm going to repair this in the operating room. But I still don't know exactly where each little fragment's going to go. And so for me, where my interests are is I want to do a little bit better. So here, this is supposed to rotate, but it's not. But what we can actually do is take this in the same computer modeling software that we used on the turtle, and I'm going to individually kind of color, just like a coloring book, each little fracture segment, until I can move them individually. And then, once I can move them around, just like somebody might animate a Monsters, Inc. movie, I'm going to put each piece where they used to be until I'm left with, on the far side here, are completed fractures. So this is what I need in surgery, and now I know where that purple piece, pink piece, and yellow piece go. So this makes it very easy for me to think through things when I get in the operating room. But we can take it another step further. We can actually print that same bone, and what we get is all these implants, these stainless steel implants that you see here, they come to us straight. And so when we get into surgery, we often have to bend them and torse them to fit on the bone. But now we can do some of that work before we actually get into the OR.
So after each orthopedic surgery, we always take radiographs to make sure that everything is as well as we want it to be. So you can see that the fracture on that view is much more aligned. You have a large plate, a smaller plate, and everything is held in place by multiple screws. So it's a very good outcome for the dog.
Yeah, and as a surgeon, I'm very happy with this, but there's some things I could do better. This screw right here, I actually want a little bit flatter across what we call the condyle, the edge of the elbow. So in the next case, what we made was actually a custom patient-specific 3D printed surgical guide that snaps onto his anatomy and his anatomy alone that directs that screw exactly where we want it to go. So we learn a little bit for every case we do, and hopefully we can do better on each successive one.
So we're still working on different research projects, and at this point the sky is the limit. So if you ever want to get in touch with us for any questions or any research project, just reach out and we'll be very happy to collaborate with everybody. Thank you very much.